you today? I'm good. Great. I'm Shelby. I'm going to be your MA today. Before we get started, can I start off with your name and date of birth? Yeah, it's Ava Vargas, 12/21/91. Okay, great. The doctor wanted me to come in here real quick and give you a brief overview on contraception and the different options and things like that there are out there. It'll be a quick presentation, about 10 minutes or so. Would that bother you at all? No, that's okay. Awesome. Well, let me get set up here real quick. Okay. So, here is the slideshow. I'm going to go over it with you. Awesome. So, have you taken any contraception before? No. Okay. Well, first, contraceptions are a form of birth control, and basically that stops the pregnancy from going on. It interferes with ovulation, fertilization, and implantation of the sperm in the egg. It can also be taken for other underlying health issues. I'm not sure if that's what you're in here for, but it can help with weight gain, weight loss, things like menstrual cycle regulation, and acne, different things like that. So a lot of people do take it for sexually active. A little bit of fun facts is most American women 15 to 44 use contraception, different kinds obviously. There's a plethora out there. So surprisingly, older women take it more often than younger women, which in my opinion it should be the opposite because, younger women are a little more vulnerable to getting pregnant. The pill is one of the most common types of contraception used, but like I said, there's different kinds out there. If you personally don't want to take it, there's options for men as well. There's also permanent and non-permanent options, so we call that sterilization. Who can use contraception? Just about anybody. Some types require specific exams. Some require an age requirement due to like the medicinal factors of it. Men and women both can take it. Men usually don't really take like a pill form or implant form, but like condoms, things like that are for men. People with underlying health problems, like I said before. So different types of contraception, there's permanent and non-permanent. Permanent is surgical. For men, that would be like a vasectomy. For women, it would be a tubal ligation or getting your tubes tied, things like that. Non-permanent, condoms, the pill, oral contraception, injectable contraception, implants, different things like that. Here's a picture of different kinds. Condoms are for male and female. There is both. They go up in your diaphragm, things like that. IUDs, implants in the arm. You can take a pill. If you aren't so good about being strict on yourself about taking a pill every single day at the same exact time, I wouldn't suggest doing the pill. Maybe something like, the implant or something where you don't really have to remember to take it. When can one begin use? There's really no right time. Like I said, there is some age-appropriate medications and different exams and stuff like that before you are given the contraception. Some things to consider are how long do you want to be sterile, your reproduction goals, your body reactions and complications, because every medication, anything you implant into your body always has a chance of complications. Not very likely, but like I said, sometimes it doesn't work. Sometimes different things work for different bodies. Some bodies don't really agree with it. There's hormonal and non-hormonal different kinds. So Things that you would need an exam for, like a copper IUD, anything with copper, you need to have a cervical inspection. Some IUDs have the chance of moving around or implanting in places that they shouldn't. They do fall out sometimes too. Not very likely, but sometimes it happens, so we have to let you know. Things like the arm implant, the depot shot, like injectables, those don't require any kind of hormones or any kind of exams. I'm sorry. If you take a hormonal type of contraception, they like to measure your blood pressure. The pill also requires a cervical exam. Also, with the, like I said, you want to make sure you are sterile as long as you want to be sterile. The pill, you can stop taking it whenever. Something like an implant is a little more, like a longer time period. So, an implant is good for up to like 3 years. Um, some of them, like the IUD, is 5 to 10 years. A patch, you would change it once a week. The ring that you stick up into your vagina, it's once a month. Sterilization, permanent. You're a little bit young for that, so I wouldn't recommend, just because people change their minds, and it's permanent, so you can't turn it back. And I would hate to see you not have children if you are able to. A few frequently asked questions: do condoms break often? No. There is a slight chance that they will break if you snag it on your rings, your nails, jewelry, something like that. But if you're careful with them, it's not very likely. Can the pull-out method save you from getting pregnant? No. Not every man is on it and can pull out fast enough. It's just really not a safe measure to take. Sperm can still get up inside your vagina and travel to implant on the egg. Birth control does not change one's sex drive. So a lot of people think that it does, but in reality, it actually heightens your sex drive because you have that feeling of you're safe. No pregnancy, no babies, unwanted pregnancies. There are very few that happen to get pregnant on birth control, but it's a measure to stop that. So, again, not very likely. Will birth control prevent me from getting STDs? No. The only thing that can semi-prevent you or maybe prevent you from getting an STD is a condom, but definitely not 100% active. So, I, again, would be careful. Yeah, so do you have any questions for me? No. Would you like to speak to the doctor? He can probably give you a little bit more information on any certain types. No, I think I'm gonna go home and check out my options. Okay, great. Let me refer over to the doctor that I presented this to you and see if he has any questions and things like that. I'll be right back, okay? Thank you.